The role of community in healing. How the people around a woman with cancer can either deepen her isolation or transform her recovery. There is a truth I keep returning to when I think about illness. Medicine can treat the body, but it takes community to help heal the person. Cancer is never experienced by the patient alone. It is lived inside relationships, inside families, friendships, neighborhood, WhatsApp groups, prayer circles, waiting rooms, and the quiet conversation that happens late at night when fear becomes harder to hide. Around every woman with cancer, there is usually some kind of community. Sometimes that community carries her. Sometimes it fails her. Sometimes it asks her to be brave in ways that make healing harder, not easier. I want to talk about something that health statistics rarely know how to measure: the invisible infrastructure that holds women together during illness. The friend who comes to chemotherapy with you and knows not to ask too many questions. The sister who notices when you are pretending to be stronger than you are. The neighbor who sends food without making you explain yourself. The women who have been through cancer themselves and know what survival costs. But I also want to ask a harder question. What happens when that community is absent, or when it becomes part of the burden? And what can a project like CHIFAA offer when a human support is not enough, not available, or not safe? Let me begin with something simple but important. Social support is not a soft extra in cancer care. It is not decorative. It is not nice to have. It can shape how a woman experiences treatment, whether she follows through with care, how she copes emotionally, and whether she feels she is carrying the illness alone. Community support does many things at once. It helps emotionally. Cancer can isolate a woman very quickly, not only because of fear, but because treatment is exhausting, repetitive, and lonely. Community interprets that isolation. It reminds her that she is still a person, not only a patient. And in North Africa, community often does something even bigger than that. It fills the gap left by former systems of care. Because in many parts of our region, psychological support for cancer patients is limited, overburdened, inaccessible, or simply absent. So, the work of emotional care is often absorbed by the people around the patient: mothers, sisters, cousins, neighbors, women in the mosque, friends from work, survivor circles, informal support networks that no hospital officially recognized, but that hold enormous weight in practice. What does that look like? It looks like the aunt who moves in for 2 weeks during chemotherapy. It looks like the brother who drives 4 hours so his sister can make hospital appointment in the capital. It looks like a woman's WhatsApp group where people exchange practical wisdom at midnight: which side effects are normal, which clinic is less chaotic, what to pack for radiotherapy, and what helped with nausea, which doctor actually listens. And that, to me, is one of the deepest inspiration behind CHIFAA, because women are already building digital micro-communities of care through voice notes, WhatsApp groups, late-night questions, and informal exchanges of survival knowledge. CHIFAA does not begin from the fantasy that technology can invent support from nothing. It begins from the opposite recognition that women have already created forms of care for one another, and that what is missing is a safer, more reliable, more structured space that protects dignity, improves information integrity, and extended that support to women who may not have it. These are often called informal systems of care, but there is nothing unserious about them. They are highly organized, emotionally intelligent networks of survival built in the space where formal healthcare does not fully reach. In North Africa, community is not simply a supplement to care. For many women, it is part of the care system itself. But I want to be honest, because community is not always healing. Sometimes the people around the woman with cancer become the very reason she feels more alone. Sometimes the first response to diagnosis is not, "How can we support you?" It is, "Do not tell anymore. Do not upset your mother. Do not tell your husband. Do not tell the neighbors here. Do not say the word cancer in front of the children. Do not make this bigger than it already is." And what sounds like protection can become another form of isolation. The woman is not only carrying her illness, she is also carrying the family's discomfort with the truth of that illness. She becomes responsible for managing everyone else's fear, everyone else's shame, everyone else's need for silence. Sometimes community means pressure. Pressure to keep smiling, pressure to keep cooking, mothering, hosting, cleaning, answering messages, showing up, and proving that treatment has not changed you too much. Pressure to perform strength in a way that leaves no room for fear, anger, grief, exhaust, or the simple fact of not being okay. There is another kind of harm that community can quietly reproduce, and it has to do with how illness changes the way a woman is seen. In Tunisia, women say, which means beauty may change, but its trace remains. I keep thinking about that saying when I think about women going through illness, treatment, surgery, fatigue, hair loss, and the all visible transformations cancer can bring. Because the truth is this: a woman does not stop being beautiful because her body is under siege. She does not stop being herself because illness has marked her. And I think too of Mahmoud Darwish when he writes, "The are the beautiful women. The beautiful women are the fragile ones. The beautiful women are the strong ones." I love these lines because they leave room for the full truth of what women carry. A woman with cancer can be fragile and strong at once. She can be frightened, exhausted, angry, radiant, and resilient. Sometimes all in the same week. None of that takes away from her dignity. None of it takes away from her femininity. None of it takes away from her beauty. And that too is part of what a real community must protect. Not only a woman's survival, but her sense that she is still fully herself, fully visible, fully worthy of tenderness in the middle of illness. And sometimes community is not harmful, it is simply absent. The woman who has moved to a city for work and has no family nearby. The woman whose marriage fractures under the pressure of illness. The woman who is already estranged from her relatives. The woman in a rural area with no support group, no survivor network, and no one who understands what chemotherapy actually does to a body. For this woman, the invisible infrastructure of care is not there, and the absence of that infrastructure is not a small inconvenience. It changes everything: how she copes, how she asks for help, how she understands what is happening to her, and how much of the burden she carries alone. This is not a rejection of North African culture. It is a more honest way of loving it. To say clearly that our communities can be extraordinary sites of care, and that they can also reproduce silence, shame, and emotional abandonment if we do not examine what we ask sick women to carry. True community does not protect the family from difficult truth. It protects the sick person from having to face that truth alone. Over the years, especially through my work as a gender-based violence advocate, I have to come to believe that women do not only need support in the abstract, they need specific forms of support, and when those forms are missing, the consequences are very real. The first need is information. Clear, accessible information in a language a woman actually speaks and understands. Not a rushed explanation in medical jargon, not an answer that assumes she already knows how the system works. She needs someone to explain plainly and with dignity what is happening in my body. What does this treatment do? What side effects are normal? When should I be worried? What do I ask the doctor next time? The second need is emotional acknowledgement, not false reassurance, not the performance of optimism. No, don't worry, you'll be fine, said too quickly. Acknowledgement is different. It says, yes, this is frightening. Yes, this is painful. Yes, this is unfair. And no, you do not have to hide those feelings to make other people comfortable. That distinction matters. Reassurance can silence a woman. Acknowledgement gives her permission to be honest. The third need is practical support. How do I prepare for the appointment? What documents do I need? How do I explain this to my boss? How do I pack for treatment? How do I ask the doctor the question I'm embarrassed to ask? Who do I call if I do not understand what I have just been told? For women in the first weeks after diagnosis, these are not small administrative details. They are the architecture of survival. And the fourth need is continuity. Not one conversation, not one encouraging message, not one dramatic show of support in the moment of diagnosis and then silence. Continuity means someone who is there over time, someone who remembers, someone who says, how did this scan go? How are you feeling after the injection? Did the nausea settle? What did the doctor say yesterday? Illness is not a single event, it is a process, and women need forms of care that stay with them through that process. Now, let me be very clear. None of these needs can be fully met by an artificial intelligence companion. Human care is irreplaceable. Real community, embodied, reciprocal, emotionally present community cannot be automated, and it should not be. CHIFAA is not designed to replace a mother, a friend, a survival circle, a nurse, or a doctor. CHIFAA AI companion, it is designed to sit in the spaces where support often breaks down. At 3 a.m, when fear is loud and the clinic is closed, CHIFAA can answer the question a woman is too afraid or too embarrassed to ask elsewhere. When a woman does not understand the word the doctors used, CHIFAA can translate it into language she understands. When she is preparing for an appointment and does not know what to ask, CHIFAA can help her organize her questions. When she feels guilty for being afraid or ashamed of how overwhelmed she is, CHIFAA can respond without judgment and without impatience. And because continuity matters, CHIFAA can do something that many systems of care fail to do. Remember context over time. It can know that this woman had surgery last week, that she was worried about her pathology results, and she mentioned pain after treatment, and that she needs support not only in one dramatic moment but across the long and even rhythm of illness. That is why I do think of CHIFAA as a substitute for community. I think of it as an extension of care, one that can reduce isolation, fill informational gaps, support emotional processing, and accompany women in the hours when human support is unavailable. And for women who truly do not have a community, women who are isolated, displaced, socially abandoned, or navigating illness in a city far from home, that digital presence can mean something profound. Not a cure, not a miracle, not a replacement for love, but a presence, a voice, a structure, a form of accompaniment in a moment where silence can be unbearable. AI cannot community, but for women who are isolated, it can be the difference between facing illness completely alone and having somewhere to turn. If episode 1 was about silence, then this episode is about what makes survival more possible once that silence is broken. No woman should have to navigate cancer alone. Not emotionally, not practically, not informationally, not spiritually, and yet many do. So, part of the work ahead for families, for healthcare systems, for communities, and for those of us building technologies like CHIFAA is to ask a better question than how we do treat the disease. We also need to ask who is carrying the woman through it, who is listening when she is afraid, who is helping her make sense of what is happening, who stays when treatment becomes routine, when the novelty of the diagnosis has passed, and when she still needs care. I'm Maha Jouini, and this is CHIFAA Podcast. Thank you for being here. And the next episode, I would love to spotlight a woman who shaped the narrative around health vulnerability, the great Arab feminist author Radwa Ashur, who turned her pain into beautiful prose when she said, "Thank you and bye-bye for now."